Hi, my name is Greg Deckard, and the topic I selected for my project is Affordable Care Act, Obamacare. It's actually called the Patient Protection and Affordable Care Act. It was signed into law on March 23rd, 2010 by President Obama. It has been and always will be referred to as Obamacare. It is a considerable piece of legislation. It's actually 906 pages, and so because of the size, I will only address a few parts of it that have to do with technology that I found interesting. A couple of numbers here, or statistics, are that in 2009, there were 50.7 million uninsured people here in the United States. And it's projected through the implementation of Obamacare that within 6 years, roughly 2016, they're projecting that there will be 30 to 33 million fewer uninsured people here in the United States. And that's a lot to add to a system that's already weighed down and already has shortages in healthcare providers. So it'll be interesting to see how that works out. One of the aspects that's going to require technological advances in the use of technology is the fact that preventive care is now free to everyone in their health plans, which means no co-payment, no deductible, no co-insurance, nothing like that. It's part of your medical plan. And so you can have blood pressure screening, cholesterol screening, and some of the others you see here on the screen done for free. And so I see that as an increased number of patients. And when you increase the number of patients to an already burdened system, you have to find a way to become as efficient as you possibly can. And in my mind and my experience, I see that as efficiency through electronic medical records and hospital information systems. Another aspect of Obamacare is that they call for voluntary accountable care organizations, or ACOs. And these are groups that get together and try to find a way to coordinate the highest quality of care for Medicare patients. And, to coordinate that level of care, obviously it's going to require electronic means of some sort, and IT is expensive. And so what has been offered is upfront payments to those organizations if they want to take them to help build that IT infrastructure. Now, one of the bonuses of this is that you get a portion, as an organization, you get to keep a portion of what you save. And there was one case, and I believe this was in 2011, where this ACO in the Bronx, New York, saved $28 million in a period of time. They were able to keep 14 million of that for their system. And so there's some incentive to adopt such a system and to make sure that you are providing that efficient care to Medicare patients. And to be honest, this is care that can really only be done through those IT systems. The administrative simplification provision is an excellent one because it's intended to reduce costs overall. The change to ICD-10 codes and the considerable number of codes that are involved in that change allows for a lot of specificity in diagnoses, which allows for more specific treatment and more specific reporting, which can help with research. health plan identifier, it's a 10-digit number that um, organizations or entities are supposed to adopt. This is something that came into play with HIPAA, but wasn't adopted or wasn't well thought out enough. And now it's going to become mandatory. It may have already been, actually. And it ensures that when organizations are billing and collecting, that they're identified uniquely. So that way it can prevent any potential issues that occur there. I'm sure many of you have already also come to realize that this is very difficult making these presentations. And something else is the health disparity issue. A lot of it does come with race, ethnicity, language barriers, and also with socioeconomic issues. And this is something else that has to be tracked as part of the this provision, so as to address these disparities and try to find ways to overcome them. One example would be that poor people aren't going to get insurance or didn't have health care insurance, and so they may be in a much worse state now than they would have been otherwise. Are you kidding me? Healthcare.gov got off to a bumpy start, as did this video. It has since, despite the initial debacle of it, they've actually, numbers have shown that 8 million people signed up by the deadline. And obviously that's a significant number as long as those people pay their premiums and keep up with their insurance. It's also been shown that roughly 3 million people sign up for Medicare. That's outside of that 8 million figure. And that's also important because with Medicare expansion and also just the knowledge that people have that they can sign up for Medicare, that's a significant number of people who are now getting care for little to no cost. And outside of all of that, a number showed, I think it was RAND, that 7.8 million people bought insurance directly from companies during that time period. And that's also significant because it shows that the competition is working and that people are out looking for these policies. What's going to happen in the future, one of the big things that they're pushing for is that physicians are paid based on the quality of care that they provide and not just simply by charging X number of dollars for patient and pushing as many through as they can and bringing those people back again and again and charging them more and more. It's going to be more of an approach that if a healthcare provider is treating their patients in an efficient manner in such a way that they don't have to come back over and over again, then they're apparently practicing good medicine. That's what I covered in the amount of time that was allotted. There's a lot more to this. There are many other aspects that involve technology and will require technology to either implement or ensure that they operate efficiently.